FND Hope is a nonprofit patient organization for functional neurological disorder. Previously recorded is an interview with Dr. Mark Edwards, Senior Lecturer at the Sabel Department of Motor Neuroscience and Movement Disorders at UCL Institute of Neurology. He also practices medicine at the National Hospital of Neurology in London. Functional symptoms is a very generalized term.
Yeah.
Do you think that, and of course the change in the DSM-5 is to take out the need for a psychological connection because they're finding that many don't. Do you think that there's possibly still a need to identify that? Because clearly, and I've ran into many people that say, I have a psychological connection. I do have symptoms worse when I'm stressed. They see it, they know it, they recognize it. But there's kind of this feeling that there's the other group that goes, I don't, that they're in denial. And do you think that maybe we need to separate those two groups out more?
Not really, actually, not really, because I think that's, I think it's slightly stigmatizing also, both ways around maybe, but I think it's separating out the psychological component from illness, sort of psychological and social component of illness, goes against everything that people have been trying to do, I think, in medicine as a whole over a number of years, which is to try to think of people more than just their physical symptoms, if you like, and to try and recognise the fact that people are more than their diagnosis, and that their symptoms have impacts on themselves, but also their families and the community, etc.
Oh, definitely.
Sorry. Yeah. So I think that I just think it's important to take a broad view of things and have a range of ways of helping people that are not just based on one theme. Okay, so at the moment, the main theme is that you need to find a psychological stressor, and when you find that, then everything will be okay. So that's not a very helpful thing for some people, because there isn't a clear psychological stressor, and it's not that they're in denial; it's just not there. But those people can still benefit from some aspects, for example, of cognitive behavioural therapy. So, for example, cognitive behavioural therapy for non-epileptic attacks is not really all about trying to find psychological trauma. It's actually, a lot of it is about practical techniques and tricks that people can learn to suppress their attacks, sort of stop their attacks from coming, and to suppress them once they've arrived. So these things called grounding techniques, for example. So those have nothing to do with psychological stresses, but they are cognitive psychological techniques, if you like. So I think it's better to keep a broad view of things, but that has to go both ways, into also doctors taking a broad view of patients and accepting the fact that if patients are telling them that they, when they've been asked in a reasonable way about psychological contributing factors, when they're not there, that's taken as they're not there, not that the person is denying them.
So, reading through research, it seems like the ones that do benefit the most from cognitive behavioral therapy are the ones that do have the psychological connection. Clearly, because the main focus, even though there is some of these other grounding techniques and things like that, the main focus of CBT does seem to be to change how you view yourself, how you view the world around you, and taking a more positive approach type things. So, and I guess I'm thinking a lot of the book, Overcoming Functional Symptoms.
Yeah.
I got the book and read through it, and I personally did not find a lot of areas that I could fill in for these things, because my symptoms had come from more physical type things that we could attribute it. And that's been a common theme for many of the people. So, and it's not to say that the book isn't any good, because it is good. It's just different. It's just more beneficial to another group of people. And I guess that's where I meant.
I mean,
as far as
Yeah.
separating them, is that
I think
knowing what and why you have these symptoms are important, because this group of people need this type of therapy more so. Not that we're all not going to benefit. Honestly, I think everyone would benefit from some cognitive behavioral therapy. I think
sure.
there's,
I'm sure.
I think, the common person walking around could look at the world in a little brighter, have a little more gratitude. But these other group of people that tend to be more physically um, symptom based, like symptoms come on after walking for a certain period of time, the muscle seems to fatigue out, seems to be more of a physio type problem. But even there, I noticed, I guess with my own experience, I had to relearn how to walk. I relearned, was doing great, running on the treadmill, that thing. By the next day, I the brain fog things come back, and all of a sudden I can't do those things again. So to me, it's like that importance of finding why the body's doing that, even though it will go back. It's always like, oh, it'll come back, give it a day or so, is important, because that's what needs to stop in order to carry out day to day.
I mean, I think if we're in an ideal world, and maybe we'll be there in some time, then I absolutely agree with you that the, the best situation would be that you could see people quickly, you could get a positive diagnosis quickly, and you could get them into an individualized treatment that made sense for them, for their particular symptoms. And I think that is the goal. That really is the goal. But we're such a long way from there at the moment, honestly, in normal healthcare land. And I think that most people are still struggling to get a diagnosis within a reasonable time and have it communicated in a reasonable way. Um, and so I guess that's why my own sort of thoughts are at an earlier stage um, of where we are. Um, but I absolutely agree with you that that's the way that treatment should go. That treatment should go to an individualized. You can imagine having a sort of palette of different treatments that you might um, uh, have available to you, and that you'd have good evidence on which one to choose for an individual person in front of you. I don't think that's an impossible task. In fact, I think it's probably quite a reasonable expectation, but it's not there at the moment. So that's why I suppose why I'm a bit sort of scared of separating people up
Right.
uh, too early on, I suppose, at this stage.
For more information about functional neurological disorder, visit fndhope.org.